telling us a little bit more about what it is you do and the role that acupuncture actually plays in the fertility space.
Sure, absolutely. So I am a acupuncturist and a Chinese medicine doctor. I'm fourth generation in my family, and I've been in practice now for about 20 years. So in my practice, our practice is Coastal Acupuncture and Natural Health Center, and we specialize in women's health, fertility, pediatrics. We treat the whole family, basically. We are a group of practitioners that provide acupuncture, Chinese medicine, naturopathic medicine, functional medicine, and Reiki, and craniosacral healing modalities as well. So my specialty in the practice is fertility, although the rest of the practitioners do treat other things as well. So in terms of how Chinese medicine and acupuncture can help with fertility, historically, as most of you may know, Chinese medicine has been around for thousands of years. To date, in terms of what's actually been documented, is about 4,000 years, but who knows? It probably went back even further. Chinese medicine actually really focused a lot on women's health because having babies was very important, right? So like, especially for royalty and the emperors, being able to leave, a legacy of children was like a big deal. So when you look at the classic formulas and when you look at the pharmacopoeia of Chinese herbs, there are large sections around fertility, women's health in general, regulating the menstrual cycle, like it's all there. So that's the part that's so amazing, is that it's been used for thousands of years to treat a variety of conditions that can still be applied to us in modern times, right? So whether it's polycystic ovarian syndrome, endometriosis, dysmenorrhea, painful menstruation, or what we more popularly see these days is diminished ovarian reserve, right? That's probably one of the toughest things to treat. In my practice, I know for sure DOR is challenging, and most of the fertility specialists, the reproductive endocrinologists, will send me the hard cases. They're always like, get them to qualify for an IVF cycle, get their FSH down, let's try to optimize their follicle count before we start a cycle. So I love those challenging cases because, I have seen the wonderful difference that implementing Chinese medicine and acupuncture can make in a woman's fertility. And not just for fertility, but overall wellness, because, you're looking at the mind, body, spirit of a patient. And when you're going through fertility, it's really all of it, and it's all encompassing. It's very stressful. And most of our patients feel very disheartened. And so I think where our practice is different than most other acupuncture clinics is that we really try to treat the heart and the soul of the patient and really try to address that heartbreak and heartache, because that's really what happens over time when you've been going through fertility treatments for years and years, or it could even be one cycle, right? It could be what everyone's tolerance level for treatment and for stress around fertility is different, right? So some patients may have been treating for 5 years and they're just persevering. They're like the warriors of fertility. And then you have other patients that maybe just did one round and they're just exhausted. So everyone's different. Everybody has their own journey, but we're definitely there to meet them wherever they're at. Acupuncture has been shown over many years and many studies to help decrease the cortisol levels in our body. So cortisol is one of the stress hormones that our body releases when we're in a fight or flight mode, right? So the fight or flight mode, back in the caveman days, it was what would be triggered when our lives were threatened, right? So if we were running away from a saber-toothed tiger or just, running for our lives, it would set on and it would allow us to do powerful things that we normally could not. Run faster, have quicker reflexes, things like that. And it's a wonderful thing about the human body. However, for us in modern times, that fight or flight mode gets triggered very easily. So it could just even be day-to-day stress events that trigger those. And so how do we turn that off? How do we shut that down? So acupuncture does an excellent job of shutting that fight or flight response down, downregulates the nervous system, and decreases cortisol levels. Within 5 or 10 minutes of the needles being placed in you, there's generally this calming effect. And you can see the transition in my patient's face and in their eyes. And that occurs because of the neurochemical release or the endorphin release that occurs during an acupuncture treatment. So what acupuncture does is it stimulates the nervous system to release these neurochemicals or these happy hormones that make us feel good. So aside from treating pain and maybe, treating digestive issues, you will always feel good after an acupuncture treatment. So that's why most patients say, gosh, I came in for back pain, but boy, I do feel relaxed. But for fertility in general and women's health, being able to decrease your stress, anxiety level, and elevate your mood is essential. So those are excellent questions. So it depends. Again, we treat you wherever you're at, whether it's natural fertility, you're doing IUI, or just a Clomid cycle, or you're in IVF, or just an FET. So the treatment plan for patients, it varies. So it just depends. It depends on what type of treatment cycle you're in. It also depends on your constitution. So when we see our patients, we will do a traditional Chinese medicine evaluation, which generally will incorporate an extensive intake of your diet, lifestyle, family history, your gynecology history, and just health history in general. We also look at your tongue, which is a very traditional Chinese medicine diagnosis tool that we use, because the tongue is a miniature version of our body. So we can see all of the different organ systems. We can see, the state of your digestion, your temperature. A lot of things can be seen on the tongue. So remember, 4,000 to 5,000 years ago, we did not have laboratory tests. We did not have x-rays and imaging, ultrasounds, and things like that. So a Chinese medicine doctor had to be really good at observing. So observation was a very, very strong skill for those doctors. So we still use those tools too. Those definitely help us in kind of identifying any imbalances that might be occurring in a patient's body and what we may need to work on. For example, if digestion tends to be a problem, that will come up on the tongue, and we'll definitely address that, because if your digestion isn't working properly, you're not going to absorb anything you're taking, right? So if you're taking herbs, if you're, eating really great nutrient, fertility friendly foods, or supplements, right? So we want to make sure we optimize your absorption of those things. So in terms of natural fertility, natural fertility is wonderful. Like if I can get an opportunity to work with a patient like for preconception care, which is generally 3 to 4 months before even trying to conceive, that's like a dream for me. It rarely happens because most patients are coming in as a referral, right? Like I failed a cycle, or my FSH is so high I can't even start a cycle, right? Mm-hmm. So that comes in a lot. Or perhaps sometimes patients already have their embryos and they just want support for the frozen embryo transfer. That happens a lot too, especially if a patient had one failed FET or frozen embryo transfer. Then they'll come around and say, I want to do acupuncture because I read about that Paulus study that was done in Germany where they had acupuncture pre and post embryo transfer. So for natural fertility, we generally will see patients around their cycle. So depending on what their challenges are during their cycle, for example, if they're anovulatory or they're not ovulating regularly, then we definitely will treat around the follicular phase or the beginning of their cycle and really try to emphasize, and time that treatment right around ovulation so we can help promote a nice, healthy ovulation. If they have luteal phase defect, which means that their half, the half end of their cycle is short. So that's from the time of ovulation to the time that they start their period. Ideal time frame is 12 to 14 days, but for some patients, their luteal phases can be very short. They could be like 8 days or 10. So instead of having a 28-day cycle, they might have a 20-day cycle. So we know that a luteal phase generally needs to be a certain duration in order for the hormones to be excreted, the progesterone and the estradiol to be excreted long enough to create a nice, thick, nutrient lining for a fertilized egg to actually implant. So if it's a really short luteal phase, there's not enough time for that lining to develop, if that makes sense. So if that's the case, then we definitely treat in that time frame too. So, and of course for natural fertility, we have freedom to do all things, right? So diet and lifestyle changes, herbs around the cycle. Usually we will identify what areas need to be treated. And I generally will prescribe biphasic formulas. So like I'll do a follicular phase formula, and then I'll do a luteal phase formula, and I'll pop in an ovulatory formula if I know that they have ovulation issues. So it's so much fun. I love using Chinese herbs. Very effective. It can definitely regulate your hormones. It can also ease your cycles, so you have less PMS, less pain during your cycle. I mean, it's just great. Chinese herbs have been used for thousands of years for regulating your cycles and for helping menstrual cramps and discomfort. In an IVF cycle, we generally will do more acupuncture. If a patient has diminished ovarian reserve or premature ovarian failure, normally I recommend that a patient come in twice a week. If a patient has polycystic ovarian syndrome and their egg count seems to be pretty good, but we're worried about quality, because generally with polycystic ovarian syndrome and endometriosis, we tend to see that quality can get compromised. So those folks we will also treat about twice a week. If a patient maybe has blocked tubes from a previous condition, then we might, and we know that their egg count's great, right? And that's not an issue. They're fairly young, early 30s, late 20s. And the only reason why they're doing IVF is because their tubes are blocked. Then we may not see them as often for acupuncture. It might be more like weekly. So acupuncture and Chinese herbs are very effective for male fertility, male health in general. So when I meet with the patient, my first discussion is always, so is your husband open to treatment? Because I do believe that when you treat both partners, your outcomes for IVF or fertility in general are much better, you know, and it really, I think there's something about treating both partners. It's like balancing yin and yang in your relationship too. So it's like, we're both a part of this, right? We're both getting treatment. And I always say, if a husband comes for the first visit, the way I explain it is, believe it or not, you guys are 50% of this embryo or these embryos, right? And so don't discount how valuable you are in this process, even though you're not carrying the baby for 9 months. You are very important. So if you make up 50% of your baby, why not optimize the genetics of your baby? Wouldn't you want a superior genetically normal, beautiful baby? And they all look and they go, yes. And so that's kind of usually the way I explain it, because for a lot of men, you know, because their part seems to be so small with their donation and their contribution on the day of retrieval, I feel like it minimizes the importance of their role. And so I really wanted to share with men that you guys are really important. Like, you make up 50% of the baby. That's huge. So, you know, what you do, what you eat, and your lifestyle is just as important. So I usually encourage, if men don't want to come in for acupuncture, because I get that quite a bit for some reason, men don't seem to want to get acupuncture as often. I mean, women love just like, let me just zen out and take a nap for 25 minutes. Guys tend to have a harder time doing that. But once they come in, they love it for sure. And there's usually some other issues going on, neck pain, back pain. So I kind of try to introduce it that way. Like, come on in. Why don't I treat your back too? And then, you know, reduce your stress, and then we'll optimize fertility at the same time. So the acupuncture points that we use, or the treatments that we use, the philosophy behind it is that acupuncture can stimulate blood flow to the reproductive organs. So whether you're a man or a woman, it's going to do the same thing. So by increasing blood flow, it also increases the nutrients, the oxygenation to the reproductive organs to help, you know, optimize egg quality and sperm quality. So acupuncture definitely 100% is great for guys. You know, basics, right? A multivitamin, extra zinc, CoQ10 or ubiquinol, vitamin E. Super basic compared to what all the women are taking, right? The women are like, I have this huge tower of stuff I take, and I take 30 pills, right? So we try to, and there have been many studies that have shown that even antioxidants, vitamin C, vitamin E, and zinc even, can make huge change in sperm parameters. So sperm volume, sperm quality, morphology can really be affected just on nutrients. So I always encourage, and you know, with the pandemic, it's very easy to say, just take some antioxidants. It's going to boost your immunity anyways. Good questions. That's what I love for patients to do. I know that life gets really busy after your little one comes, but generally for my patients, don't get rid of me that quickly. So once you get pregnant, whether it's natural IUI, IVF, I generally will recommend at minimum to stay with me for your first trimester. So that's the first 12 weeks of your pregnancy. And that's pretty essential because for the women that I treat, they've had a lot of ups and downs in their journey. So stress and anxiety continues. It's not like that falls away once you get your positive pregnancy test. It seems like it almost elevates to the next level because then they're thinking, oh my gosh, I need to stay pregnant too, right? And for many of my patients, they've had loss, whether it's one time or it's a recurrent pregnancy loss situation. So it's essential for those patients to continue to feel supported, relaxed, less anxious. Mm-hmm. So I do see my patients through the first trimester. I've also created a formula for supporting the pregnancy too, and also alleviating some of those wonderful first trimester symptoms of morning sickness and fatigue. So, and after that, the general pattern is that in the second trimester, everyone feels really great. You know, their digestion's better, they have more energy, and they're getting used to the pregnancy. They feel way more secure about the pregnancy. So I don't see them as often then, but in the third trimester, I encourage patients to come back for labor and delivery support, just to kind of get them ready for that process. And then I always highly recommend postpartum care because it's really the fourth trimester. And to be honest with you, Dominique, in this country, fourth trimester is like ignored. Unless you're like a doula or in the natural birthing world, you know, or a midwife. Like, I really feel like there's a gap in the care for women after they deliver. It's sort of like, okay, you're on your own now, go home. But that is such a critical time, I think, for us women to get the support we need. In China and Asia, your mom moves in with you, like literally for 3 months, and she takes care of you. She cooks and she cleans. And it's I don't know if you've heard this, it's called the lay period, where a woman, she basically lays in bed for like 30 days. This is traditionally, and takes all these herbs. The baby's brought to her to nurse. I mean, she's kind of like a queen. She served her food, like everything's done for her. And the reason why that was done was for quicker, better postpartum recovery. And if that happens, then you are able to have an easier time getting pregnant the second time, right? So it's all about that process. How can we get you back into shape and ready to be a healthy mom again? So, so postpartum care is very important. I highly recommend patients continuing. I have a lot. Okay, I'll give an IVF story first. So probably about 12 years ago, I had this patient, can't even remember how she found us, but anyhow, she came to see me. She was a secondary infertility case, which meant that she already had a son who was about 3 years old. And she had just moved from Oregon. And this woman was very beautiful and youthful. I mean, when you met her, you thought, oh, she's in her late 20s, right? And when I looked at her chart, I had to take a double take because she was 45. And I looked at her history and I saw that she had 11 rounds of IUI. And I just went, wow, that's a lot of IUIs. And she said, well, yeah, you know, when we were up there, money was an issue. So we didn't think we would need to do IVF. And, you know, it's quite a bit more expensive. And the doctor just kept recommending, and she had moved around multiple doctors. And so I came to the conclusion that I think most of the doctors didn't remember her age because, and this was for a period of time. It wasn't like 11 in a year. It was like 11 over 3 years maybe. And I thought, well, gosh, I mean, I feel like, and she just looked so youthful. And I thought that's got to be part of it, right? Like, why wouldn't they recommend other types of treatments? And even within the IUI realm, you could do other things too. So she had met one of my fantastic friends, Dr. Eileen Hatch in Irvine. Her and I actually have worked really closely together, especially with diminished ovarian reserve. Like, she's an expert in that, and really coming up with just customized treatment plans that no other doctors would even think about doing for women in their 40s, mid 40s, upper 40s. Like, she's definitely the DOR expert. Anyhow, so we had met, she was under her care. And so we quickly started our acupuncture treatments. We did a combination of acupuncture and moxibustion leading up to the day of transfer. I had the privilege of being there on the day of her transfer, which was on 4th of July, and I think that was very lucky. And so her transfer was on 4th of July, and our protocol for the day of transfer is we treat 30 minutes before the embryo is transferred and 30 minutes after. And this is based on a German protocol that was published in Fertility and Sterility in 2002. It's a very, very popular study. I'm not sure if you're all familiar with it, but if you're not, it's a great study. Anyhow, so based on that timing and that protocol, we treated, and then she was on bed rest. So this particular doctor has a very strict bed rest, and I call it house arrest program post-transfer. So it's bed rest for 3 days, house arrest for another 4 days. So you're pretty much, I call it an IVF vacation. You're like not doing anything for like 7 days. And luckily she was staying in this beautiful home in Newport Beach with a gorgeous view. So it literally felt like an IVF vacation. And she invited me to come and do a house call because she couldn't leave. So we did that. And lo and behold, she was pregnant with her second. And so she was 45 and a half when she delivered her baby, her second son. And it was a great story because she had one shot. She had only saved enough money to do one IVF. And so it was like a lot of pressure. It was like, this is my only cycle I can do. Yeah. And she had one embryo. So it was a golden embryo.